trigeminal cervical nucleus. Imagine that. This nerve and these nerves meet in this little train station. They tell us about how your trigeminal neuralgia has been and your dizziness and your headaches, etc.
So everything's been almost gone.
Wow.
It's been very, very minor.
Jasmine, what's up?
Hi.
So you've had a lot of things improve since coming in here, but tell me
Yes.
what you've said today after you came in. Well, tell me about your headaches before you came in today. What have they been like?
My headaches were 5 to 7 days a week. I think the longest migraine I had lasted about 20 days.
Oh, wow.
Yeah.
Oh, that's before you started coming in
Yes.
at all? Yeah.
Yes.
And you
that
had
was
the
part of
electrical
everything.
shooting
yes,
pain
the
in the face?
trigeminal neuralgia and the TMJ. So my jaw would just lock closed or lock open depending on the headache, and on both sides too. So it was really affecting everything a lot. The headache and the jaw
Is it
pain.
down to a 1 out of 10?
Yeah,
or is
it was like
0?
a 1, 0.5 to a 1.
0.5. And then how's your jaw feel?
Jaw's completely better. Like I can't even hear the clicking sounds anymore. So.
Isn't that crazy? So all that tension was caused by the upper neck.
Yes.
Pretty cool, huh?
Yes.
High
Thank
five.
you.
Yeah. Hey, we've seen you before.
Yes.
How's the electrical shooting pain into your face?
So that is mostly gone.
Good. And how is your migraines and all that kind of stuff? Is that doing better?
Yes, everything's improving.
Tell me what's going on right now with your jaw. What can you feel?
So every now and then I start getting some TMJ symptoms and my jaw locks up. But every time you fix or adjust my axis, it's gone.
Axis is the second bone, okay? And there's a lot of people that come in with problems that are related to here. When we correct it, their jaw starts to open normally and they don't feel pain. And then we can go in and do things with the jaw. We actually work on the masseter and the pterygoids deep inside the mouth just to release it. But the main cause is coming from up here. And then anything in the jaw can be compensatory, okay? So her is rotated to the right. And then her atlas also has a problem. So we'll do the atlas with a really specialized machine in here, which is where we get most of the bang for our buck, right? That gets a lot of the change. But the second bone needs to be manually moved. Just quickly, I'm not doing a lot of, there's not a lot of movement, but it's very quick and fast. And that takes a lot of tension right off this area. So, this gets neglected. I can't even count how many upper cervical practitioners don't really even touch the second bone. And that can sometimes be the driver of problems I see in our clinic. We'll have people who have been to upper cervical and thought they have already tried it and gave up. That's because they only touch the top bone, which is often the case. But some of these cases, like hers has a lot. Just trying to move that second bone this way, it does not move. This way it swivels really easily. So we snug right there as she breathes. There we go. Feel that? And immediately. We'll go to the other side. So we pushed it this way. If you look, I pushed it this way. Now we're going to come on this side and continue to push it so it's rotating clockwise in her case if we're looking down. So come slide close over this way. You can hold your chin just so I know your head won't fly away when I push, right?
Mm-hmm.
So we come in right here, just like that. So go back. Okay. Go ahead and sit up. Tell me how you feel after that. Do you notice it pretty quick, or does it take a little bit of time for it to show up?
Yeah, so it feels a lot less inflamed. Can open it better.
What does a lot less mean? Let's put a number out. 10's the worst. What was it before? What is it after?
So it was like an 8 before, and now it's down to a 5. And I just know that once you do the top bone, it's just going to be completely gone.
So we're saying the atlas actually responds best to subtlety. If we go in there with our hands and start manipulating things, the muscles tighten up and protect. And that's why a lot of chiropractors have a hard time and just avoid this area completely. And like we were saying before, the atlas cannot be felt from the back. You have the second bone, the axis, the C2. You can feel that from the back, but the atlas is only palpated or felt from the sides, right underneath in here, deep inside. So that's where this is going. We're gonna lay her on her side. Just make sure she's neutral. Right there. Just gonna move your shoulder. Hold still, as in don't. Yeah, let your head continue to relax like that. See if I need to modify it at all. It's just a leveler to help us make sure we're in the right region. And this just changes a tiny bit here. Okay. So hers went anterior or forward on this right side, right underneath this bony prominence, which is called the mastoid. That's part of the skull. as you can imagine, there's not much to feel when you hear that little vibration that shoots a direct beam of energy right towards the atlas. With her, we just do a couple taps there. Go ahead and sit up. And then you can turn and face this way for me. Let's feel the base of your neck. Yeah, it just feels so much better. Mm-hmm. Especially compared to when you used to come in. So there's the tension right here at the base of the neck completely relaxes. Go ahead and lay your back. And we're going to evaluate the rest of this map too. With her, she gets a short leg on this right side, just like the map here. She's usually really tight. Pull your knees up. Let's look at that. And she's even. Perfect. We'll feel the back just to see how the muscles go. And how does that feel?
Really, really good.
Really good. What did it feel like before you came in today?
It was super tight on one side. Not as bad as usual because we've been working so hard.
Tell me about your... Oh yeah, go ahead.
No jaw pain.
No jaw pain?
It's all gone.
Zero?
Yeah.
Open up? Can you open up more? Or what does it feel like? Is it
I can open up more. It's not like locking as much. And I used to wake up and my jaw would be locked, and it doesn't happen at all anymore. So
isn't that so cool? So we see this with patient after patient after patient in our office and lots of other practitioners that do upper cervical care. So you'll see through our reviews, my practice and others, we see so many people with jaw problems or shooting pain in the face like you've had before. And that's coming from the top of the neck. And that's a little anatomy lesson for you. This pink line is representing the trigeminal nerve. That's just, there's 12 cranial nerves, and this is one of them. And then you have the atlas bone is right down here in the neck, right? So how is this related? Is the cervical bones, C1, C2, C3, there's nerves right here. These feed into a little spot in the brainstem called the trigeminal cervical nucleus. Imagine that. This nerve and these nerves meet in this little train station. And so when there's obstruction and pain here, it can refer into that area. So that's exactly what's going on and why we have patients that'll have this issue here. It's not a problem in the face, which it can be, right? But in the case that we attract in our clinic, there are problems coming from here, and it will always result in improving that if there's a dysfunction here. All right, we haven't seen you for a few months now, so yes. You came in today. Tell us about how your trigeminal neuralgia has been and your dizziness and your headaches, etc.
So everything's been almost gone.
Wow,
it's been very, very minor, and I think it just started coming back when I started working longer shifts, which it would do that to any normal person.
Yeah, so. Your job is taking a lot of time and energy, right?
Yeah, yeah.
But it's very minor now, huh? And you don't have it very often.
Yes.
So I call that a victory.
Yeah.
You are victorious.
Thank you.